Hello dear patients, today we are going to talk about moles on penis. A patient came to our clinic and at the base of his penis, on the pubis, there were moles that you can see on the picture. These are not quite moles, these are papules or nodules that were lifted above the skin level. The patient notes some itch in the area of moles and an increase of their number. So dermatoscopy was done and we came to a conclusion that these are not condylomas acuminatas of dark color. In spite of preliminary opinion, analysis for human papillomavirus was taken. This is a smear from the surface of these neoplasms and from inside the canal. Apart from that, scraping for oncocytology was taken from the surface of these neoplasms, and C100 protein was taken as a marker of melanoma. So all these indicators were normal. Human papillomavirus was negative, and oncocytology with C100 protein were within normal. So a diagnosis of nevus was set, and secondly, considering its location and presence of itch and gradual growth of these nevus, its removal was done. Removal was done by radiowave method with histological study. All these elements, papules of dark brown and sometimes almost black color, were removed. They were removed relatively superficially. Histological study was taken from one of the areas, that is, a part of this mole was sent to histological study, and as a result conclusion said that this is complex nevocellular nevus. You can watch separate video about what is complex nevocellular nevus on our channel. Speaking shortly, the combination of the factor that nevus cells are cells that are similar to melanocytes, are located inside the skin relatively deeply, as well as in superficial skin layers, in epidermis. As a result of that, these moles are slightly lifted as you see on our picture, and they have a rough surface. Usually, if such moles are located on other areas of skin and they don't bother the patient, then there is nothing scary in it. However, their localization in the area of sexual organs is a provoking moment for oncological danger. And secondly, they bother the patient by itch and by enlargement in sizes. So this removal was done correctly and no following relapses of such moles were observed. First, there were superficial scars in the area of removal, and they gradually resolved under an influence of specific therapy by anti-scar external medications. You can watch a separate video on our channel about what it is. So if you are bothered by some neoplasms in the area of penis, particularly by pigment neoplasms, then in the majority of cases it's better to remove them, because as I said, the area of penis is an area of increased oncological danger. If any neoplasms develop in the area of sexual organs, you can consult urologists, dermatovenerologists and gynecologists of our paid medical center of Dermatovenerologic Dispensary in Moscow. We have experienced specialists who do diagnostics and treatment of such neoplasms. We are waiting for you in our clinic. Please subscribe to our channels on YouTube and Instagram. Thank you for your attention.